Hello, I'm Preston Boyer. I am a pediatric and congenital interventional cardiologist at JohnsHopkinsAllChildren'sHospital in St. Petersburg, Florida. As cardiologists and interventionalists, one of the conditions that we often treat is a PDA, patent ductus arteriosus. We know that a PDA can have high risks for patients in the neonatal period and even throughout their life. It can lead to early conditions such as heart failure and feeding problems, and even later on in life can contribute to conditions such as pulmonary hypertension or increase the risk of infections in the pulmonary arteries or endarteritis. So treatment for the PDA has long been sought after, but it wasn't until 1938 that a treatment was developed. At that time, the chief resident in surgery at Boston Children's Hospital, Dr. Robert Gross, undertook a surgical procedure which was considered fairly radical at the time to close surgically the PDA of a patient. Luckily, that surgery went very well and had great results, and that ushered in an era where we could finally start to treat PDAs via surgical method, which was very effective but still came with a lot of risks of undertaking surgery. And so it wasn't until the 1960s or 1970s when pediatric interventional cardiologists began to develop techniques and devices that could potentially close the PDA via transcatheter method. Since that time, that technique has really been refined, and the ability that we have now and the devices that are available to us make this a really safe and very effective procedure for closure of PDA. One group of patients, however, has remained quite a challenge for both surgeons and interventional cardiologists, which is premature infants. Premature infants have the highest rate of incidence of patent ductus arteriosus. They also have the highest risks of problems from those ductus arteriosus, and so have been a population that really has needed treatment, or people have been looking to try to treat for a long time. Within the last 5 to 10 years, we've been able to now develop devices that are specifically designed to be deployed or via transcatheter method in patients, premature infants, even the ones weighing around 1 pound, the smallest of the premature infants that we have. Those devices are safe and effective and really amazing to be able to do such a procedure in such a small patient. As an interventionalist, I'm really excited to be a part of this, excited to be performing these procedures, and I see that this is only going to continue to get better and more effective as we develop new devices and techniques for this procedure. So PDA has been understood to be a high-risk problem for a long time, and thankfully at this point in time we have really safe and really effective methods to close a PDA via transcatheter method, even for patients who are the smallest of the small, that we can do safely and effectively.